Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're beginning our nose series, so get excited. We don't currently have a name or something kitschy and cute for it yet, so if you come up with something, we're open to suggestions. But anyway, let's start with the nose. So the first topic I'm going to talk about is deviated septums, because I got a question about it in one of our previous videos. So the septum is the middle part of your nose, and it divides the right side from the left side in terms of your breathing passageways. It's not, you can see a little bit of it on the outside, but almost all of it is internal. And if you kind of stick your fingers in your nose and kind of wiggle something back and forth, that is most likely your septum. It is made of both cartilage and bone. Pretty much everyone is born with some degree of a septal deviation, so just because you have a deviated septum does not mean that you need to have surgery for it, although your deviation might be worse than someone else's, etc. But some patients will come to me and they're like, I have to have surgery because I have a deviated septum, and that's not necessarily the case. You have to have a reason beyond the fact that it's deviated. Most commonly, it's because the deviation is so bad that it's actually affecting your ability to breathe on one side. One of the ways you can tell that is if it's always one side is worse than the other. We'll talk about another reason behind breathing issues for a different one later. But if you always feel that one side is worse than the other, might be thinking about deviated septum, that's pretty bad. So that might be an indication to do a deviated septum surgery. The other common reason we will do deviated septum surgery or a septoplasty is if we need to get cartilage for the nose. And we'll talk all about this stuff later, but basically your nose, the way it's shaped is based off of the skin and then a combination of the cartilage and the bone underneath. So if we need more cartilage, we will take it from the septum if there's still some there. Okay, so that's Septoplasty 101. It can be done either in a closed fashion, meaning you only have internal incisions, or it can be done in an open fashion, meaning you have at least one external incision. There are different reasons to do it one way or the other. It's a pretty basic surgery if we're just doing a septoplasty alone. However, very commonly you're doing a septoplasty plus something else, and this is the part where the question was, what do they mean when celebrities say they had deviated septum surgery, but their nose now looks different? They probably did have a deviated septum surgery, so they're not lying, but they're also not telling you the full truth, which is that they also had a rhinoplasty on top of it. So you can't actually really change how the nose looks if you're just doing a septoplasty, with one small exception. Most likely they also had a rhinoplasty too. So that's all that on septums for now. There is going to be a lot more coming in this series. See if you guys have any cute names for us, but this is Lexie Wang, facial plastic surgery at West End Plastic Surgery in Washington, D.C., and I'll see you guys next time.